Welcome. Have you ever felt the world spinning uncontrollably, even when you're perfectly still? Or experienced a sudden, intense bout of dizziness that seemed to come out of nowhere? If so, you might be familiar with the unsettling experience of vestibular neuritis. In this video, we'll dive deep into this condition, exploring its causes, symptoms, diagnosis, and the path to recovery. The exact cause of vestibular neuritis remains somewhat of a mystery, but the leading theory points to a viral infection. Think of viruses like the common cold or herpes simplex virus, the one responsible for cold sores. These viruses can inflame the vestibular nerve, which is crucial for balance. While less common, inflammation can also be triggered by bacterial infections or even, in rare cases, autoimmune diseases. Essentially, something has irritated or damaged the nerve responsible for telling your brain where your head is in space. To understand vestibular neuritis, let's look at what happens inside your ear. The vestibular system, located in the inner ear, is responsible for balance. It contains intricate structures in the vestibular nerve. When a viral infection attacks this nerve, it causes inflammation. This inflammation disrupts the normal signals being sent to the brain about your body's position. The brain then receives conflicting information from the healthy and inflamed sides, leading to the sensation of vertigo, that overwhelming feeling of spinning. Vestibular neuritis can affect people of all ages, but it's most common in adults between the ages of 30 and 60. It doesn't discriminate based on gender or ethnicity. While it's not considered a particularly rare condition, pinpointing the exact number of people affected is difficult, as many cases might be misdiagnosed or go unreported. What we do know is that it's a significant cause of acute, prolonged vertigo. The hallmark symptom of vestibular neuritis is sudden, severe vertigo. Imagine being on a roller coaster that won't stop. This vertigo is often accompanied by nausea, vomiting, and difficulty with balance. Many people also experience nystagmus, which are involuntary, repetitive eye movements. This happens because the brain is trying to compensate for the disrupted balance signals. Vision can also be blurry or jumpy. Importantly, vestibular neuritis does not usually cause hearing loss or tinnitus, ringing in the ears. If you experience these auditory symptoms along with vertigo, it could indicate a different, but related, condition called labyrinthitis. Diagnosing vestibular neuritis involves a thorough examination by a healthcare professional, usually an otolaryngologist, ENT doctor, or a neurologist. They'll start by taking a detailed medical history and performing a physical exam, paying close attention to your balance, eye movements, and neurological function. Specific tests, such as the Dix-Hallpike maneuver, can help rule out other causes of vertigo like BPPV. Further testing might include an ENG electronystagmography or VNG videonystagmography to assess the function of the vestibular system. An MRI may be ordered to rule out other serious conditions, such as a stroke or tumor, that could be mimicking the symptoms. While vestibular neuritis doesn't have distinct subtypes, it's important to differentiate it from labyrinthitis. Both conditions affect the inner ear, but labyrinthitis involves inflammation of both the vestibular and cochlear nerves, leading to hearing loss and tinnitus in addition to vertigo. Distinguishing between the two is crucial for appropriate management. Treatment for vestibular neuritis focuses on alleviating symptoms and promoting recovery. In the acute phase, medications like antiemetics can help control nausea and vomiting, while antihistamines or benzodiazepines can reduce vertigo. However, these medications are typically used short-term, as prolonged use can hinder the brain's natural compensation process. Vestibular rehabilitation therapy, VRT, is the cornerstone of long-term recovery. VRT involves specific exercises designed to retrain the brain to compensate for the damaged vestibular nerve. These exercises can help improve balance, reduce dizziness, and ultimately restore a better quality of life. In some cases, corticosteroids may be prescribed to reduce inflammation, but their effectiveness is still debated. Unfortunately, there's no guaranteed way to prevent vestibular neuritis, primarily because the triggering viral infection is often unavoidable. Maintaining a healthy immune system through proper diet, exercise, and adequate sleep may help reduce the risk contracting viral infections in general, but it doesn't specifically target vestibular neuritis. The prognosis for vestibular neuritis is generally good. Most people experience significant improvement within a few weeks to a few months, especially with vestibular rehabilitation therapy. While some individuals may experience residual dizziness or imbalance, these symptoms usually diminish over time as the brain continues to adapt. Research is ongoing to better understand the underlying mechanisms of vestibular neuritis and to develop more effective treatments. One area of interest is the potential role of antiviral medications in the early stages of the condition. Furthermore, advancements in VRT techniques are constantly being explored to optimize recovery and minimize long-term effects. Thanks for watching. and we hope this video has helped you better understand vestibular neuritis.